I'm an infectious disease doc, and I've spent most of my career in the context of HIV and AIDS. And I'm really proud of what we've accomplished there. But today, I want to tell you a story about a new challenge I've taken on involving hepatitis C. Roughly 4 million people in the United States are infected with hep C. So that's roughly 4 times as many people who are infected with HIV. Hep C infects the liver and leads to liver failure and death in 40,000 citizens a year. And that's about twice as many people who's died of AIDS. Now, HIV and hep C are similar in many ways. Both viruses were discovered in the 1980s. Both viruses are transmitted through blood, sex, and from mom to her baby. And both viruses are pretty nasty. But the big difference is this. Hep C is curable, readily curable. Over the last 36 months, about a dozen new drugs have been created that cure 98% of people with one pill once a day for 12 weeks. That's it. 98% cured, virus gone. Oh, and as a bonus, once someone's cured, they don't transmit the virus to anybody else. So we have the potential to eradicate hep C from the United States. All we have to do is identify all 4 million people, get them into care, give them one pill once a day, and it's gone. But there's a catch. The new hep C drugs came to the market wearing a price tag of $90,000 per treatment course. So if we're going to cure 4 million people, that runs up a cost of about $360 billion, which is more than we spend annually in the United States on all prescription medicines. Now compare this $90,000 to what it costs in other countries, say Egypt, $900, 1/100th, or sub-Saharan Africa, $300. In the former Soviet country of Georgia, a drug company is giving that country free drug, and they will eradicate hep C from the Soviet country of Georgia by the year 2019. So you're sitting here wondering, well, how can this be? Well, let me help. In the United States, medications are regulated, but prices are not. So you can have the pharmaceutical companies will come out and they can set their prices at anything they'd like. So the usual rationale for this is that research and development will pay for or justify the cost, but in reality, R&D costs are only about 15 or 12% of a pharmaceutical company's budget. Now, the issue is that when the companies charge this amount, you sit there and wonder because, as evident on television, every time you see a golfer pitching for a high-priced drug or a celebrity, or perhaps a couple sitting in bathtubs holding hands at the sunset, you know their marketing costs are quite a bit higher than their R&D costs. So it's a fallacy to say that the R&D costs, therefore, prices must be high. Now, these are not alternative facts or fake news. These are honest-to-goodness realities in a healthcare system run amok. Another fallacy, a belief held by many, is that the market will control the costs. Now, this may be true if there are multiple options for any single disease, roughly comparable to when we buy a car or a TV or a cell phone. But this is often not the case. If you want to live, you need to buy what keeps you alive. And the competitive options that would ordinarily keep prices in check simply don't exist. What's worse, we as providers, patients, go to buy drugs, and the price is hidden from them, and even hidden from the provider who prescribes the drug. Say what? That's right. Providers prescribe and patients buy without knowing the price tag. Not exactly like buying a car or a TV or cell phone where you can find your prices on the internet. So you're probably wondering how that can happen. Well, here's how it works. Drug prices are negotiated, but the negotiated price is kept under a shield of confidentiality, or I call it a cone of silence, where only the drug company and the agent of the insurance company are the ones who know the price. The actual price is hidden from the consumer patient and the providing physician. Now, if this sounds to you like theater of the absurd, well, then you heard it correctly. It is theater and it is absurd. We call it health care, but for the 4 million people with Hep C, it's what keeps us from getting them into care and curing them, because at these prices, we can't afford it. The system, as rigged by pricing, doesn't promote health care. It promotes disease and welcomes death. Let me offer an idea or two to you for consideration. First, let's get rid of the law that prohibits the federal government from negotiating lower prices with pharma. In case you missed that, there is a law that prohibits Medicare from negotiating from lower prices with the federal government. So let's get rid of that. Once we've got negotiated prices, we, the people, should be able to see those prices. So let's require the government to publish the prices for all of us to see. As a provider, the government tells me what they're going to pay me for my services, and that service cost is published. Let's have the government tell pharma what they're going to pay for drugs and publish the price. And while we're at it, let's have them demand that all insurance companies publish the negotiated price for all of us to see. This would create downward pressure so that the price of drugs would go lower. A simple solution would be to open our borders to the importation of generic drugs. Now, these drugs are produced safely, cleanly, and effectively all over the world. Given a borderless market and open negotiations and published pricing, patients, providers, and payers alike will have access to the lowest cost medicines. And finally, let's get rid of laws and loopholes in the law that allow drugs that, like Daraprim, which cost about $10 a few years ago, and in one day went from $10 to $750 in one day. Or remember EpiPens? That drug was $100 a few years ago. Now it's $600. So let's get rid of that loophole that allows these renegade companies to charge ridiculous prices for life-saving medicines, crippling our ability to keep them alive. So, what can we do to enact this change? What can we do? Let me offer you a couple suggestions. Number one, get informed. Test what I've just told you and see if it's true. There are ample websites that give you accurate, deep information on this topic. One of my favorites is the Kaiser Family Foundation, which is a phenomenal website for all things related to healthcare and financing. Or just simply Google drug pricing in the US, and you'll be flooded with reliable websites that can inform you. Even Wikipedia has a great page on this topic. If you found that I misled you in any way, call me on it. But if you found that I told you the truth, join me on this issue. Number 2, write and call your congressmen and women. Write them, call them, visit them when you're in D.C. Tell them that you're embarrassed by the facts of this matter. Tell them that you want negotiated lower pricing by the government, those prices to be published, get rid of those loopholes that allow EpiPens and Daraprim to be priced at ridiculous levels, and create competition by opening our borders to the importation of generic drugs. What could be more American than that? And finally, believe in the possibility of change. As evident through our political season, there's no question that change is possible. And whether I agree with the change or I oppose it, the evidence is mounting that an informed and motivated public can enact change. Believe it, act on it, and join me in saving costs, but more importantly, in saving lives. This is one example where the old adage is absolutely true. The life you save may be your own. Thank you.